Tridyne Vascular Sealant is clinically proven to seal aortic anastomosis and perform under pressure. Tridyne Vascular Sealant is a single-use device intended for use in aortic surgery when adjunctive measures to achieve hemostasis are required by mechanically sealing areas of leakage. For full prescribing information regarding Tridyne Vascular Sealant, including indications, effects, routes, methods, frequency and duration of administration, and any relevant warnings, contraindications, side effects, adverse events, and precautions, please view the information included at the end of the video, as well as the instructions for use included with each product. Tridyne Vascular Sealant Instructions for Use, Part 1. Kit Setup. Each unit of Tridyne Vascular Sealant contains two separate kits, an applicator kit and a chemistry kit. Each kit is provided as a double peel pack tray for easy introduction into the sterile field. When assembled and mixed, these kits will prepare a total volume of 4 milliliters of sealant. The Tridyne Vascular Sealant applicator design allows for quick and easy setup in a matter of minutes. To highlight a few of the key steps in the setup process, use the Tridyne Rules of Two as a guide. The applicator kit contains a dual-barrel applicator housing, a locking push rod, 2 standard spray tips, a 5 milliliter vial of sterile water, and a 3 milliliter syringe with a pre-attached needle. The chemistry kit contains 2 cartridges, one preloaded cartridge containing 2 milliliters of processed human serum albumin, or HSA, and one preloaded cartridge containing a dried white powder called polyethylene glycol, or PEG. In a controlled room temperature environment and using aseptic technique, open the applicator and chemistry kits into the sterile field. Step 1. Using the syringe provided, draw 2 milliliters of sterile water. Please note that the entire volume of sterile water will not be used. The syringe provided is clearly marked at the 2 milliliters level to indicate the appropriate volume of sterile water to be used. Step 2. Inject the 2 milliliters of sterile water into the cartridge containing the white powdered PEG. Step 3. Mix the water and PEG by gently rocking the cartridge from end to end. When all of the powder is dissolved, the solution is ready for use. Mixing of the PEG solution is generally complete within 2 minutes of hydrating. Once mixed, the PEG solution must be used within 20 minutes. Do not use the rehydrated cross-linker after 20 minutes, as the performance of the sealant may be compromised. Step 4. Do not attach the spray tip yet. With the applicator housing pointed upward, load the HSA and PEG cartridges. The cartridges may be loaded into either of the twin chambers. Gently press the ends of each cartridge to seat it into place. When properly loaded, the cartridges should sit flush with the end of the applicator housing. Step 5. Do not attach the spray tip yet. Point the applicator housing straight up to allow any air in the chemistry cartridges to rise to the top. Insert the locking push rod into the openings in the rear of the cartridges. The push rod will snap into place when properly engaged. Please note that the Tridyne push rod is designed to lock into the applicator housing. Forced removal of the locking push rod from the applicator housing may result in potential damage to the applicator system or the chemistry cartridges. Step 6. With the tip of the applicator pointed upward, briskly flick the applicator to free any air bubbles. Express the air by gently but firmly pushing up on the push rod until the stoppers in each cartridge are aligned with one another. Take care to express as little fluid as possible during this process. Step 7. Wipe the applicator tip with clean, sterile gauze to remove any liquid that may have been expressed with the air. Avoid mixing of components. Do not wipe from one cartridge opening across to the other. Wipe each opening separately. Step 8. Attach a spray tip to the applicator housing by placing the tip on the applicator and rotating it clockwise 1/4 turn until locked into place. Each Tridyne kit includes 2 applicator spray tips. The Tridyne Vascular Sealant Kit is now ready for use.